Hello, everyone. Now we're starting. We're live. Welcome, everybody, whole ADHD Europe and beyond. This is Sandra Kooij and Dora Wynchank from the Netherlands. And left is Dora and right is me, Sandra. And we're both as specialists in female ADHD working in the Netherlands at SciQ. And we cooperate with Amsterdam University Medical Center. And our recent updates on female ADHD, we are happy to share with you since we published an international paper recently with all the overview on the current research that is available in the world. And we didn't do that alone. We did it with a large group of female researchers mainly that are interested in female ADHD. So there are a lot of them now. And this is a very promising story because it will help us to speed up what we need to know about women with ADHD. We will have half an hour, both of us, to talk to you about what we learned and what we described in the paper. And then we will have half an hour for discussion and Q&A. So I think we should get started, don't you?
Brilliant. Go ahead.
Okay. So what we do know and do not know about female ADHD is described in this paper, Research Advances and Future Directions, the lifelong interplay of hormonal fluctuations with mood, cognition, and disease, by the Special Interest Group on Female ADHD at Unithides, and here are all the names. It was published in July of this year. And we started with the question, what do women need? It's not a movie, it's about women with ADHD. And we started asking the women what they need for what type of research they need to answer their most urgent complaints. And we found a paper, we found an inventarization by Attitude in the United States and the Duke Center, also from the United States, and they both inventarized among a few thousand women with ADHD what their basic research needs were. And here they are listed. First is, what are the unique harms of a late or incorrect diagnosis in women with ADHD? So women are later diagnosed than men, and this has a lot of consequences for them. Is the onset of puberty associated with worsened ADHD symptoms in women, and if so, why? Why is menstruation in ADHD more commonly associated with debilitating symptoms of premenstrual syndrome, PMS, and premenstrual dysphoric disorder, or PMDD, and what treatment strategies are useful? While the risk for postpartum depression, PPD, and anxiety among women with ADHD is 5 times increased, why are the treatment strategies aimed at women with ADHD still lacking? Good question. Why do women with ADHD experience exacerbation of ADHD in perimenopause, and how can this be addressed and treated? What hormonal contraceptives are the best for women with ADHD and why? What menopausal hormone therapy is the best for women with ADHD and why? What is anyway the role of hormones in ADHD during episodes of reduced estrogen? And finally, what do we know about cognitive decline in postmenopausal women with ADHD, so after perimenopause? So a lot of questions you see here are urgent and prominent, important to women with ADHD. They have been collected, and we try to answer those questions in our paper and discuss what we know and what we still don't know and need to know. First of all, the harms of a late diagnosis in girls and women. Research has shown that women and girls are later diagnosed, and even if they're diagnosed, they're less treated, especially with medication. So they lag behind twice. First, the age of diagnosis is later, and then the treatment also lags behind. Often women and girls are diagnosed with anxiety or depression, but not the ADHD, which is overlooked. Undiagnosed ADHD in women, however, is associated with teenage pregnancy, risky sexual behavior, self-harm, and eating disorders. So it has a cost not being diagnosed timely. It has a negative impact on relationships, self-esteem of girls, and school performance. And we need to stress that women mask and compensate their symptoms in order to fit in. and to belong and to be part of society and the female community, but it takes high costs for themselves because they easily get worn out and burnout. About the onset of puberty. Some studies, but not large studies, have studied whether or not the puberty onset, so start of the menstruation, is later or earlier in ADHD, and it's still unclear. So we don't know yet. But we do know that symptoms of ADHD often increase after the onset of the first menstruation. And this must have to do with the hormonal fluctuations that come with the cycle and the premenstrual week. We also know that women have more side effects of medication compared to adolescent boys, so adolescent girls have more side effects. And we still don't know why that exactly is and what we can do to improve that. From our own research, we know that there is a huge impact of hormonal changes on ADHD and mood. So women with ADHD in our research showed a 2 to 3-fold increase of premenstrual, postnatal, and perimenopausal depression, and also an increased severity of ADHD during those episodes. These episodes, all episodes have one thing in common, that's the decrease of estrogen and progesterone in those episodes. So the week before menstruation, the month after giving birth, and the period before the last menstruation, the perimenopause. And you can ask yourself why. How does this occur? What is the background of this to understand it better and to find better treatments for women who suffer from these debilitating symptoms? Well, you may be aware that dopamine is an important neurotransmitter in ADHD. A neurotransmitter is something in the brain that helps signals to flow through the brain and to connect with each other. And dopamine seems to be dysregulated in ADHD. And this may be associated with the symptoms we see of hyperactivity, impulsivity, mood swings, and inattention. Estrogen happens to be a similar compound that has similar effects in the brain, and it reinforces dopamine function. So if you have estrogen at higher levels, as in the first half of the cycle, you may have a better focus, memory, and a more stable mood as compared to the last part of the cycle. This is exactly what women experience, isn't it? But if you have ADHD and you are low or dysregulated regarding dopamine levels, then you have low estrogen in the last week of the cycle. You have twice too low levels to be able to control your behavior, your mood, and your focus. And you may have severe difficulties with functioning because estrogen compensates for dopamine decrease and vice versa. But when both are low or dysregulated, you have nothing to cope. That's how I understand it now. So this is interesting because if we understand this interaction between estrogen and dopamine in women with ADHD, we may be able to find better solutions. So what can we do about premenstrual depression? As it's severe and debilitating. Well, we can advise women to use the pill, the oral anticonceptives, all 4 weeks of the cycle. That reduces the fluctuation in the last week when you might have a stop week. So if you keep the level stable of estrogen the whole month, you might have less symptoms. But this is not always true and not for all women. An antidepressant, SSRI, serotonergic reuptake inhibitors, those are proven effective for premenstrual depression, sometimes only half of the cycle and sometimes the whole cycle. So this is definitely an available option already. We recently, Dora with Maxime de Jong, studied 9 women with premenstrual depression and tried whether a small increase of their stimulant medication dosage could improve premenstrual and ADHD severity increase symptoms. And it did. In all 9 women, 30 to 50% increase of stimulant dosage, the normal dosage of the rest of the month, improved the symptoms of premenstrual depression and ADHD severity. So this is hopeful because women can easily ask their clinician for a little bit higher dosage in the last week so they can cope with the symptoms of premenstrual depression and increased ADHD severity. But we still have to study this in a double-blind way, placebo-controlled study, and we asked for a grant recently to do that. So if we can prove that it's also true when we compare with placebo increase of dosage, then we're in business and we can really advise it to everyone. But for you now, it's good to know that this might be a new way of treatment. Then sexuality in adolescent girls with ADHD is also a topic. And girls with ADHD tend to start earlier to be sexually active. They may have multiple partners. They may have risky sexual behavior. They make less use of contraception, leading to teenage pregnancies, of course, and sexual transmitted disease potentially. And they are also less sexually satisfied with sexual contacts they have. So there are increased rates of risky things like the pregnancies, the SOAs. There's also more sexual abuse in girls with ADHD, and there is more non-heterosexual and transgender orientation. So maybe they try to find out what's best for them, and that's just normal in adolescence, of course. But it's more than other girls in adolescence. So these activities, these behaviors are associated with emotional dysregulation, impulsivity, and also oppositional behavior that occurs in ADHD. What about contraceptives? The pill and progesterone-only pills have been shown in research to be associated with an increased rate of depression, especially in young women with ADHD. This is a bit worrisome because we want them to use estrogen in order to stabilize mood, potentially in the last week, but it also leads to depression. And we still don't understand exactly why this is and what happens. Maybe they are anyway more sensitive to mood problems. Maybe they induce mood problems by forgetting to take the pill now and then, giving fluctuations in the estrogen levels. Maybe we anyway don't know which is the best contraceptive for whom, and we have no data on the effects of an IUD in young women. So we definitely need to study this much better in order to be able to advise. And now we get Dora, and she's even much better and complete than I will ever be. So here she comes. We change seats.
Okay. Are we going to move? Okay. Right. Well, it's always an honor to speak with Sandra because she's been in the field for many years, and she's the founder of research in adult ADHD in the world and the founder of the Diva interview, which allows people across the world to diagnose ADHD. So it's an honor to share the platform. Okay, so I'm going to talk to you about hormonal birth control in women with ADHD. What happens to women after they give birth? Do we see more hormonal problems and gynecological problems in women who have ADHD? What happens to memory in the menopause for women with ADHD? I'll talk about the themes that came out of this research paper. We'll have a little discussion, and then I'm going to stress why you are so important. ADHD Europe, why we couldn't do this without you. So women, as you heard from Sandra, with ADHD are much more likely to become mothers at a young age, teenage pregnancy before the age of 20. So what's really important is that women and girls with ADHD get effective contraception because the consequences of an unwanted pregnancy are severe for the mother and for the child. It's better if you're going to use something that is long-acting, like an IUD or an implant, than a pill, because it's easy to forget the pill. Especially when you're really impulsive, you might just have sex, and then without having planned contraception, that can become an issue. We heard from Sandra that oral contraceptives may raise the risk of depression 5 times in younger women. But remember, this is a difficult study to interpret because there are 30 to 40 different kinds of oral contraceptives. So which one is doing what? We need to tease that out with more research. So we have to study ADHD and which contraceptive methods are best and what promotes healthy, stable mood the best. And we also have to see whether women perhaps don't want to take hormones, what are the options for them? What about non-oral preparations of contraceptives, like, for example, an IUD? Would that be helpful? What happens to moms after they give birth? Well, as you know, there's a higher rate of unplanned pregnancies, and during pregnancy, women with untreated ADHD are more likely to smoke, to use alcohol, and to have a lot of stress. They might already have one child, and that child might also have ADHD, and now they're pregnant. There might be a single parent. So all of this increases stress, which creates problems for the mom and for the baby. We know that having ADHD is associated with more complications in your pregnancy, high blood pressure when you're pregnant, giving birth prematurely, and having an unplanned cesarean section, which also brings medical risks. Our studies showed that postnatal depression is much higher in women with ADHD. Now, what's interesting is that some women choose to stop their ADHD medicine during pregnancy, but there has in fact been a trend recently to continue taking medication. And that's something that every woman with ADHD needs to weigh up with a prescriber. Is untreated ADHD more dangerous for me and my pregnancy, or in fact, are the small risks associated with using ADHD medication much better in terms of being stable during the pregnancy and not turning to drugs perhaps or alcohol? Some women will just discontinue, and as soon as they've given birth, they'll start up again. Methylphenidate is pretty safe, and when you're planning to breastfeed, we don't advise amphetamines. Maternal ADHD is not just involved in effects on the pregnancy and the birth, but might also affect the relationship between the child and the mother, the baby and the mother, the bonding issues. Many women with ADHD, once they've given birth, with all the sleep deprivation, with all the needs of a baby, feel overwhelmed, and that can make them feel depressed, anxious, and impact on how closely they bond with their babies. So in research, we really need to look at this important issue of depression. When a woman we're treating is planning on having a child, we need to talk this through with her and keep her in treatment, in fact, during her pregnancy. We need to find safe treatments for these mothers. We need to also try and stop ADHD being passed down from generation to generation. Now, of course, some of that is genetic and we have very little control over it. But on the other hand, there might be some interventions that are helpful to limit the impacts of untreated ADHD. What about hormonal problems and gynecological disorders? So you heard Sandra saying that these are really important because estrogen is so protective. We know that women with ADHD have higher rates of endometriosis, which is when the lining of your uterus starts to grow excessively or maybe even starts to grow outside of the uterus. So in your pelvic cavity, around your bowel, for example, it's incredibly painful. It's a secret illness. People don't speak about it. It's also associated, ADHD, with going into menopause too early. Women who have cysts in their ovaries, what we call polycystic ovarian syndrome, have a higher chance of having children with ADHD. So there's some link there. We haven't completely understood what's happening, but mothers with PCOS have more risk of having children with ADHD, and it's something to do with the male hormones, the androgens. When a woman stops her ovarian function before the age of 40 years, goes into menopause basically before or at 40 years, we call that premature ovarian insufficiency. And that is potentially more common in women with ADHD. As Sandra said, estrogen is not only important for many bodily functions, but it impacts on neurotransmitters, chemical messengers like dopamine and serotonin. And when you lose, at a young age, you lose your estrogen function, it can cause mental symptoms like struggling to focus, having emotions all over the place, struggling to sleep maybe because your temperature regulation is not good, you're having sweating at night, hot flushes, fatigue. And bad sleep and feeling distracted and brain fog, these overlap with ADHD. And sometimes it's hard to know what's the ADHD and what's the premature ovarian insufficiency. So this is also an area that we need to be more aware of. Endometriosis is genetic, so it runs in families, but it's also an inflammatory disorder. So it's involved in creating a lot of inflammation in the body. And we know that inflammation is a big talking point in ADHD. Sandra's got a lot of knowledge about that, so you can direct questions at her about inflammation and ADHD. It's an area of a lot of interest now in research. So what we want to know from future research is, does ADHD increase the risk for hormonal disorders, or is it in fact these gynecological and hormonal disorders that increase the risk for ADHD? And how does inflammation interact with hormones? How can we protect women from these problems? What happens when women hit the menopause? Even without ADHD, many women who stop menstruating for a year, so that's the menopause, average age is 51. Women without ADHD complain of brain fog. They complain of other mental symptoms like depressive mood, being very irritable, forgetfulness, struggling to focus. This is even worse, as Sandra mentioned, for women who have ADHD. So their menopausal symptoms are worse. And we know that having low levels of estrogen is linked to part of the brain, in fact, shrinking, and the experience that you can't remember and think clearly. That's called subjective cognitive decline. Now, from some research that we were associated with a group in Iceland, we know that ADHD is associated with earlier symptoms of coming into the menopause. We know from a study in Sweden that women with ADHD seem to be menopausal at a younger age, so perhaps around between 40 and 45 years. Now, these studies need to be corroborated, but ADHD does seem to be linked to an earlier onset of menopause. Sometimes it's hard to know, is this menopause or is this undiagnosed ADHD, or is it both? In addition, the menopause brings lots of sleep problems for women with and without ADHD, because you're sweating at night, your heart is pounding for all sorts of other reasons. And sleep disorders are prevalent in ADHD, and they also, when you're not sleeping well, your brain will not function well either. So it worsens your thinking ability, your executive dysfunction. So we also know, interestingly, from 3 studies from the US, from Epison, that for women who have brain fog in perimenopause, psychostimulants, lisdexamfetamine and atomoxetine, which is a non-stimulant, but those 2 classes of drugs improve cognitive function. So it's possible that would also be true for women with ADHD. We need to know more about how do we treat women with ADHD in the perimenopause. That's really important. Do they need higher doses? Do they need different kinds of doses? In order to answer these questions, we need long-term studies on brain function and brain imaging. And we also need to look at the role of hormones, supplementing hormones for women in the perimenopause. I want to say a word about the heart, because one of the highest causes of death for all women, in fact, once they hit menopause, is cardiac problems. So yeah, we're all worried about breast cancer, but in fact, cardiac problems are really important too, and they're different in women compared to men. Women with untreated ADHD have more risk of obesity, high blood pressure, and problems with their blood lipids or fats. And when your hormones are all over the place, it can affect your hunger signals, and it can make you perhaps overeat and binge eat. ADHD behaviors like being up late at night, not sleeping well, not moving enough, those promote worse lifestyle and problems with fat and energy levels. We know that psychostimulants help control appetite, but you've got to make sure that they don't push blood pressure up too high. We've got to be careful about women who also have migraine, because those can increase vulnerability to cardiovascular problems. So we need to be aware of how heart problems present in women as opposed to men, how different they are, and also what the influence of decreasing estrogen towards the menopause, what impact that has on the health of your heart, and how hormones can in fact protect you from cardiovascular problems. So the themes that came out of this Unithides paper were that we know that hormones are important across lifespan in women. Women with ADHD, particularly when it's untreated, have all sorts of extra problems related to their reproductive health, mood disorders, and even their cardiac health, and I've mentioned inflammation. We need to join forces with gynecologists and cardiologists and psychiatry to give women with ADHD a combined health package. And that Sandra's been instrumental in setting up in the Netherlands. She'll talk about that maybe a bit more. This research that we do should look at how neurotransmitters like dopamine interact with hormones. So we know that ADHD is in men, but look at how those same medications impact women, because women, as you heard from Sandra, have side effects. So you are so important. We need, okay, I'm going to change the slide. We need ADHD Europe because you are our advocates. You are unified across Europe and many other countries to raise awareness in women. You help us in our research because you collaborate with us and you spread our findings like this kind of webinar that we're having tonight. You are also in a very good position to push for gender-sensitive policies. You have a voice in government. You have a voice in Brussels, in the European Parliament. You can help train clinicians will watch this video after it's been posted online and learn about these issues. You also give people who have ADHD at their own families a platform to share their experience. And also you help us researchers push forward your needs, like the Duke Center did at the beginning of our talk, that those women articulated what their research needs were. We've also followed that up with a big survey that we did where we asked the women, what do you want to see researched in ADHD psychiatry? And finally, your work helps us reduce stigma and it allows for more knowledge about ADHD in women, and hopefully across Europe and the world, we can have equitable access to diagnosis and treatment. So thank you, ADHD Europe. Thank you to the audience. And I believe we're now going to take questions, which just know that if you type in a question, I think your name will come onto the screen. So just be aware of that, but we will attempt to answer your questions.
Yeah, this last slide shows our new video platform, ADHD Power Bank, that we jointly developed. It's about what is ADHD, what's the neurobiology of ADHD, how is ADHD properly assessed, how do we use DIVA, the diagnostic interview, what about all kind of comorbid conditions, psychiatric, mental, physical, hormones, sleep, everything, bipolar, autism, everything we can think of will and is being addressed in short videos of only 20 minutes. So we want to share with you that it exists and that we will have a presentation next month through ADHD Europe to show you around the ADHD Power Bank. So you can decide for yourself whether you want to take a look there. It's a paid platform, however, but maybe you like to learn more about how your psychiatrist should treat you, and so that you can speak the same language as doctors do, because it's meant for both patients and professionals. So our aim is also that we can better understand each other when you're looking for help. So we're now ready to take questions if everything goes well. I can see, yeah, here's one. Coco, thank you. I was born prematurely via cesarean section. I'm quite sure my mother has PCOS. I've been diagnosed with PCOS myself and I experienced ADHD-like symptoms such as brain fog and fatigue since puberty. Yes, this is a connection that Dora just mentioned, that we don't know why this happens. We do know that in PCOS there are many difficulties with fertility, with cysts in the ovaries, with obesity. Here's your question. I always wonder if PCOS alone can cause ADHD symptoms, or if the two just tend to occur together, and I have both. Yes, it's a very good question that we still can't answer. And we're also wondering whether PCOS is associated with ADHD in women. We do know it's associated with ADHD in offspring of those women. But our survey among 3,600 women with ADHD or ADHD symptoms will learn us more soon, because we have asked this question to all those women. And we've asked many other questions too. Thank you, Coco.
Yeah, so we can look at those women who answered the questionnaires, what is the prevalence of PCOS in them, and perhaps is there a family history the way you're reporting? Alina, yes, Alina. Also, do you know of research looking into collagen, hypermobility, and ADHD women?
Whoa.
Well, yes, you're at the right place to ask that question. Sandra will fill in because she's an expert in this field, but it's a very new field. We know that about 50% of people with ADHD have hypermobility of the joints. That means that their joints are very, very flexible. For example, you can put your thumb on your forearm, or you can touch the floor with your hands flat on the ground. And this is about very loose connective tissue in your joints, but also your skin, in your blood vessels as well. And it seems really amazing to be able to do the splits and to be so flexible, but actually in the longer term, it gives rise to a lot of problems with physical health. We believe it's also related to blood vessels and tissues in the brain itself and in the nervous system, where those connective tissues are so flexible that you are more likely to have inflammation. It's related to leaky gut. So that is an area that we are, in fact, looking at. It's another big question that we're asking in the survey. It's also related to certain kinds of allergic reactions, but maybe you can talk about mast cells and...
Yeah, well, you must understand that the skin and the mucous membranes are your defense against allergies and bacteria and viruses that are outside our bodies everywhere around us. And if the skin and the connective tissue is weak, it might as well be more permeable than it should be, thereby allowing allergens, bacteria, and viruses to enter your mouth, nose, ears, eyes, throat, lungs, gut, stomach, vagina, bladder, everything. So it means that you have more chance of having asthma, for instance, or migraine indeed, or irritable bowel syndrome, and many other infections such as allergies and eczemas and dry skin and itching and all kinds of things that are related to inflammation and allergy. And we know that ADHD comes with a lot of allergies. So it might also be a way to explain the high comorbidity with these kind of inflammatory diseases that are more frequent in ADHD. So we're quite excited about this connection because it might explain so many unanswered questions we have. Dodo.
So there was a question before about very heavy menstruation, menorrhagia associated with ADHD. Often women, I think yes, that one exactly. Heavy menstruation and adverse reaction to hormones. So yeah, it's so individual. Some women will say the oral contraceptive pill works really well for me. I'm stabilized, especially if I don't have that stop week and I keep every day of the month for 4 weeks on the pill. I am stable emotionally and my ADHD symptoms feel better. And other people say, my gosh, the hormones make me feel so depressed. So I think per person we have to tease it out. But cycle problems, heavy periods, irregular periods do appear to be more common in women with ADHD.
Yes, I agree. Yeah, sometimes it's hard if you can't have hormones. While we think it's basically also hormone interventions that might help, because if your mood deteriorates, you may better maybe have an SSRI, an antidepressant, although you may not like that, but that might be true. But we still have to find out what's the best way to treat every woman's problems. Thank you. Yes, I was diagnosed with PMDD. I've noticed that the days before my period, maybe 2 or 3 days, if I take my 5-ANS meds, makes me feel more irritable. Have you seen that before? No, we see actually that premenstrual depression comes with irritability as such in the days before menstruation. And most women who take ADHD medication experience less severe irritability and mood swings. And sometimes if they increase the dose a bit and discuss this with your physician, please, this may be helpful. So I'm not sure how to understand this.
I haven't seen this either. It might be that the irritability premenstrually is so strong that even with the Vyvanse it's coming through, and it might be useful to, as Sandra said, to increase the dose a little bit and see if that flattens out the irritability.
Yeah, but please speak first to your doctor, as we have only studied 9 women so far, and it's not a placebo-controlled study, and your physician needs to consent because he needs to prescribe you a bit more every month. Okay. Yeah, the link between ADHD and PCOS, we just tried to answer another question about that. There is a link between ADHD and polycystic ovarian syndrome, saying that women with PCOS get more children with ADHD. And we don't know yet whether it's also true for the reverse correlation. So we don't know if ADHD comes with more PCOS. We do know PCOS has more ADHD offspring. Yeah, MCAS. MCAS is mast cell activation syndrome. I already touched that subject in a few questions before. There is a relationship between hypermobility, postural orthostatic hypotension, and MCAS, mast cell activation syndrome. And mast cells are cells containing histamine. And histamine is something that you get inside your body when there is inflammation. Then histamine cells release their histamine, and that helps to cover the inflammation response of your body. But when the mast cells are too overactive, they may attack your own cells and tissues. And this is what we associate with autoimmune disorders. And it seems that in at least 50% of people with ADHD, there is a increased tendency of hypermobility and MCAS and orthostatic hypotension. Orthostatic hypotension is that you feel dizzy when you stand up from sitting or laying down, and you get dizzy and you get palpitations and you may faint or almost faint, and you usually have a low blood pressure. Having a low blood pressure is considered to be healthy, but not if you faint all the time and injure yourself, of course. And it might as well point to this hypermobility or weakness of the connective tissue. And the connective tissue is also inside your blood vessels. And your blood vessels need to have some strength to get the blood up from your legs back up to your heart and head. And if not, you feel that and you may faint. So low blood pressure may in fact already be a sign of weak connective tissue and the rest. If you want to know more about this syndrome, you can look online at Ehlers-Danlos Society or patient organization or hypermobility websites. They explain in detail what variety there is in severity of these syndromes and what symptoms are there that are interesting to learn more about.
Maybe just 2 other quick things. When you have this tendency to have low blood pressure, when you change position, like from lying down to standing or from sitting to standing, means that the blood vessels have sort of sloppy connective tissue. The tissue in the blood vessels is not contracting strongly enough to push the blood up to the brain. And you can help those blood vessels by wearing tight stockings or compression stockings. which obviously can be a bit hot to wear in summer, but they help keep your blood pressure up. You can also use other methods of keeping your blood pressure a little bit higher by drinking salty drinks or isotonic drinks like bouillon, and that can help too. So basically, we're talking about a triad, 3 aspects. The one is the mast cell activation, having this hyperactive immune response. We're talking about the blood pressure instability, particularly when you change position. And the third one is the hypermobility. And those 3 tend to cluster together, and there's a higher prevalence of that cluster in people with ADHD.
And in people with autism, I would like to add, because it's something that runs in neurodivergency per se. We don't know yet what to recommend for contraceptives in women, because we learned that not every contraceptive is good for everyone, especially for the young women. We learned that it may induce depression. And we don't know why, if it's due to the pill, or if it's due to forgetting the pill, for instance, or whether the depression was already there and only a bit increased. We don't know yet. We have to learn. The IUD does not contain hormones, or it contains only progesterone. And we're not sure what that does on mood. It has not been studied. So maybe we still have to find out which is the best. How to treat collagen? Yes, how to treat a weak connective tissue. Well, when you have weak connective tissue, you may easily get injured in your joints and muscles, and you may have several hernias, back hernias. You may have sleep apnea because your tongue is also weak and drops into your throat when you lay on your back at night. There are many, many manifestations of weak connective tissue. And unfortunately, so far as we know, you cannot really treat it. You cannot change the makeup of your connective tissue. It would be a golden market if you could, I suppose, because there are a lot of problems coming from weak connective tissue, as we just told you. But what people usually do is training and sporting more to increase their muscle harness, I would say, to get more constraining a musculature around the connective tissue or underneath the connective tissue. That may help support to your body to stay upright and straight and able to do what you need to do.
Mm-hmm. So we know in all ages, building your muscle bulk is so important, and losing muscle is one, as you grow older, is one of the biggest causes of disability later on in life. Having a fracture of your hip is of course related to losing mineral density in your bones, but it's also related to losing the cushioning of muscle around that joint. So related to weak connective tissue, if you have good, strong muscles, if that's possible, you're less likely indirectly to injure your joints. So what Sandra's saying is about good lifestyle and wherever possible, keeping your muscles as strong as they can be. There was another question I think that came up. Increasing stimulants during the last week of the cycle might help. If I normally have 40 milligrams of lisdexamfetamine, should it be increased by 30 to 50%? So in the case series that we described of those 9 patients, right now he wants me to increase from 40 to 50. So that's a smaller increase. Maybe the psychiatrist. So first of all, I think it's good that you're doing this under guidance of a psychiatrist. That is good. Second of all, maybe the psychiatrist is being a little bit conservative and saying instead of increasing by 50%, let's just start with a smaller percentage. But if that is ineffective, the move from 40 milligrams to 50, if you notice no change in those last 2 weeks, then actually maybe it needs to be increased a little bit more. But you'll only know that if you try it. And something else I want to say is that it's not just the last 2 weeks and the day that menstruation starts, everything disappears. We noticed in that case series that a few days, some women had to continue taking the increased dose a couple of days into menstruation. It's not like automatic. The minute you start bleeding, your symptoms disappear.
Yeah, you have to wait until estrogen increases, and it usually takes a few days at least. So after the onset of menstruation, you still may have some difficulties the first few days. Next question by Tanya about credible research on benefits of yoga for female ADHD. Are you aware of any research there?
You know, there is some research on anxiety and stress and the effects of yoga, and particularly the breathing exercises associated to yoga. So yoga is not only about positions that you know, stretching in positions, it's also about structured ways of breathing. And those have been shown in a particular paper. I can maybe send it to Sandra. Sorry, I can send it to Chantal. One study looked at 5 minutes of breathing exercises. Box breathing was one, extended exhalations was another, 3 breathing exercises in anxious students. This study showed that there was in fact a reduction in their anxiety symptoms. So that's not directly about ADHD, but we know that anxiety coexists, and particularly in women with ADHD. So good breathing exercises could have an effect on the anxiety levels, which indirectly could affect your ADHD symptoms, because it's harder to think clearly when you have sort of an anxious mind. At the same time, I'm not aware of specific studies looking at yoga treating ADHD symptoms.
No, but I think it's not bad to do yoga when you have ADHD at all. Same is true for Pilates or biking or walking or running, if you can. So sports are very good, and relaxation is important for everyone, and especially for people with ADHD who seem to be stressed out all the time. But having said that, to me, it always seems a bit difficult for people who can't focus to really get into yoga effectively. So it also depends on whether you feel for it, whether you're interested in it, where you can do it without being distracted and really have the effects of yoga that are intended. Mm-hmm. Then the question about ADHD and PMDD in premenopause and how it affects functioning in women mentally and physically. Good question. We now know from indeed 2 studies that show that ADHD women may enter menopause earlier than the mean of the women in the population. So before 40 or beginning of the 40, 42, 43, 45. And what happens in women who already had premenstrual depression in the last week of the cycle, they perceive that the depression advances in the cycle. So instead of having it only in the last week, you may have it in the last 2 weeks. It indicates that the estrogen level is dropping earlier in the cycle than you used to perceive it. It was firstly only in the last part of the cycle. Now it's the half part of the cycle. That means that estrogen is dropping earlier. That means that the levels are declining. This may be a sign of entering perimenopause. So if you have premenstrual depression that's creeping up, advancing in the cycle, you might consider to look for whether you have perimenopausal symptoms such as sleep loss, hair loss, dry skin, more depression and mood swings, which you already had because your PMDD is advancing, but also night sweats and hot flushes, maybe difficulty keeping up your having to pee more often because your bladder is becoming less elastic, and therefore it cannot contain as much urine as it did before. And this is also a reason for not sleeping through during perimenopause, because you need to get out of bed for the toilet. And all these symptoms, you have to check online what all the symptoms of perimenopause are in order to understand whether or not this might be the case in your situation.
I want to add one more thing to that combination of PMDD and ADHD. So we know that women with ADHD have a higher prevalence of difficulties with mood and worsening ADHD symptoms before they menstruate. But what that teaches us about ADHD in women is that it's not that the symptoms the whole month are the same, that women with ADHD cycle. And when you think about ADHD in men, they're basically more or less the same every day of the month and every month of the year. But women with ADHD, not all, but many of them, have these fluctuating symptoms. And when they look back, they can't recognize how they were premenstrually, and they were so irritable they could even be suicidal. The ADHD was so bad. So I think we have to have a different way of conceptualizing ADHD in women and think about it as a sort of more, for many, as more of a cyclical problem.
Never stable.
Yeah, exactly.
Yeah. Why do people often realize they are also autistic when they start ADHD medication? I'm not sure I hear that a lot. I'm not sure either that it's related to medication, but it may be true that when you start ADHD medication, you are able to focus better and also to see connections, to make connections between your life history and your symptoms and the difficulties you have seen, and maybe that helps to be able to see that you may have other conditions like autism, but also maybe other disorders.
Okay, is there a link between uterine cancer and ADHD or autism, especially in women with a history of heavy bleeding and PCOS? So there are certain cancers that are increased in women with ADHD, and that is related, in fact, more to their sleep issues and not directly, we believe, to the ADHD itself. It might be an indirect reason because women with ADHD perhaps are less vigilant about going for checkups, but that's something we really want to research with our big survey now. Is there a link? We also know that melatonin, the sleep hormone, is anti-cancer and is protective. So if you have very late nights, your brain is exposed to less melatonin at night because you're a night owl, and therefore you might have more chance of getting certain cancers. That has been shown in people who have night shift work, not necessarily directly ADHD. But in terms of specifically uterine cancer, I would say not that I know of. What I can say is cervical cancer, because that is related to herpes virus, and that is sexually transmitted. So perhaps there would be an increased prevalence. It would make sense if there are more sexually transmitted diseases in people with ADHD. One would perhaps expect that correlation, but it's not something that I have read.
No, neither have I. I don't know.
Okay, natural micronized progesterone therapy. So that is progesterone in a soft capsule taken at a therapeutic dose. Swallowing it at night or taking it vaginally is a successful treatment for me personally for both surgical menopause due to PMDD and ADHD. So that's quite a complex question. Some people might have an artificial menopause. They may have breast cancer. They may then get drugs, chemotherapy that suppresses the breast cancer, but at the same time, it throws them into menopause. Or they might have it surgically because their ovaries, for some reason, are then removed and they can't produce their own hormones from the ovaries. So one would then use hormone supplementation, and usually it's a combination of estrogen, bioidentical, body's own estrogen, and exactly what's written here, micronized progesterone. If you swallow the progesterone at night, it has an impact on your stress levels and on your muscle spasm, and it helps you sleep better. So progesterone works on a neurotransmitter called GABA, which is responsible for calm, relaxation, and also better sleep. Whereas estrogen works on all sorts of other things, your heart, your joint, inflammation, your bones, your brain, and of course, reproductive organs. So yes, to get back to the question, I would say that micronized progesterone is a good medication to take if there are no risk factors for taking hormones.
Coco, you're stunned by the connections. Yes, so are we. We're still learning every day and we still don't have all the answers. And it's true that you can be hypermobile but not have significant joint problems. But you may have other issues like, wat zijn spataandoen ook weer?
Varicose veins.
Varicose veins, I just mentioned something. So it depends, and not everybody has everything, and not everybody has the same pattern. But look it up and check whether or not you find yourself back in the Ehlers-Danlos and or hypermobility websites.
And then, do women who have PMDD tend to have worse menopausal symptoms? Yes, it is unfortunately associated with a worse menopause. And in it, unfortunately, women with ADHD tend to have more PMDD. So, and they also...
And postpartum depression.
That's
60% reports postpartum depression in one or more pregnancies. So that's terrible. That's something nobody knows of. And it's not being treated properly, I'm afraid, too. Yeah.
Is there any evidence that vortioxetine suits ADHD people better than traditional SSRIs? Anecdotal evidence. We start standard with an SSRI, and when people fail treatment on an SSRI, we move to other types of antidepressants. So we don't have a preference for vortioxetine.
No, we also use bupropion, which is a dopaminergic antidepressant that is very useful for depression. And SSRIs may be more useful for depression with comorbid anxiety. And SSRIs are being proven effective for premenstrual depression. So we usually stick to that.
Okay, I often have no trouble falling asleep, but my sleep tends to be restless. I often twirl my hair while sleeping. Could that be related to ADHD? Yes, people with ADHD do have more movement in their sleep, and particularly there's a higher prevalence of what's called restless legs syndrome, but it could perhaps involve the arms as well. So it's limbs. And that has been studied, and it's often linked to low stores of iron. And you can test ferritin levels in the blood, and if that is low, you can supplement the iron stores, and you can also give particular medications that help with restless legs.
Yeah, so you should definitely see your doctor and talk about restless legs at night, because it can be treated in 1 week with effective medication while supplementing your iron if it's low.
Okay, I think we had another question. I've been staggering my Elvans 2/3 of the dose and 4 to 5 hours later, the last third, to avoid the crashing or what's called the rebound. There doesn't seem to be research in this.
Yeah, that's true. We know that Elvans is supposed to work 14 hours in children, but in adults we find in clinical practice that it usually works much shorter, such as 6 to 8 hours, sometimes 10 max. And we are quite common using twice-day dosing. And then we use a little bit higher dose in the beginning and then a lower dose early in the afternoon, because if you give the second dose too late, people have difficulty falling asleep, because Elvans especially has effect on the difficulty falling asleep. And therefore we always treat late sleep before we start any stimulant, in order to prevent that Elvans can aggravate the already existing late sleep onset problems. And we do this with 1 milligram of melatonin at 10 p.m. in order to sleep at 11. And that is pretty effective, I must say.
Yeah, I just want to add to that we commonly dose with Elvans more than once a day. So what you are doing is something that we often actually do. Sometimes we also add short-acting dexamphetamine later on.
Yeah.
I think the question that's coming up now should be perhaps the last question, seeing that we
we have 1 minute left.
Yeah.
Whether it's possible to test hormonal fluctuations during a cycle. Yes, that's possible. It can be objectively measured, but it's very expensive if you want to do it throughout the cycle. And that's the reason that we do not do this regularly, also not in research. But you can better use an app for monitoring your symptoms during the cycle, and also taking notes when the menstruation starts and when it stops, and when your potential ovulation might be, and you can measure your temperature to know when your ovulation takes place, And there are apps for that may explain everything, how this female cycle works. So you can get you can get control over your symptoms by first knowing when they happen and what exactly your symptoms are. And if you have these 2 months, one after the other, you can confirm a premenstrual depression pattern if it's there. And you can show that to your GP or your psychiatrist or gynecologist, whatever you need.
Yeah, and to add to that, so the 2 apps that we use are Maya and Flow, and we also have a paper and pencil PMS calendar that we can share. That you actually asks about the ADHD symptoms and the PMS symptoms, and you rate them every day, and then there's a whole way to rate them, and then you can see patterns emerging if you prefer pen and pencil.
Yes, and we're publishing a paper about practical tools for measurement of symptoms across the cycle, across the lifespan in women with ADHD, and Dora is the first author, and we hope it will be published soon, and we will definitely share it with ADHD Europe as well.
Yeah.
So thank you so much for your attention and for all your questions that we weren't able to address all. And we'll keep in touch. And you'll see us in November for ADHD Power Bank showing you around.
And thanks, Chantal, also for all the organization behind the scenes. And have a good evening.
Bye.
Bye.